to kind of see some of you virtually on camera there, and thanks for joining us this evening to hear a little bit more about our Nature Prescriptions project. So we'll just do a quick round of introductions before we get into the kind of main bit of the presentation. But I'm Kiri. I work at the Yorkshire Dales National Park Authority as the Education, Engagement and Wellbeing Manager. So anything that is to do with supporting groups to come and access the Dales. We work with a lot of school groups, we work with a lot of community groups. We've got a real focus on underserved communities and kind of reducing barriers to access for different groups of people, and also anything around kind of health and well-being and supporting people to access the national park to benefit their health and well-being. So I'll just pass over to Heather to do a quick introduction as well.
Hi everybody, yeah, I'm Heather McNiff from the North Yorkshire Moors National Park Authority. Very similar role to Kiri. I lead on engagement and wellbeing and health and wellbeing first through all of the work that we do, again with young people, with families, with community groups, with youth, through arts and culture as well.
And Olivia, do you want to just do a quick introduction too?
Absolutely. So I'm Olivia Sharpley. I am a Masters by Research student at York St John, and I am working alongside Kiri in the Yorkshire Dales National Park specifically to evaluate the Nature Prescriptions project and do a bit of research into how it can increase well-being and decrease health inequalities. I'm at the point in my research where pretty much everything is planned, and I will hopefully start data collection in the new year. Like I said, I'm looking specifically into nature prescriptions in the Yorkshire Dales National Park, but as I will discuss, it's something that could be applied to all national parks or protected landscapes as well in the discussion on using landscape for health.
Brilliant, thanks. And you'll hear from both Olivia and Heather just later on down in the presentation there. So just to begin, so Nature Prescriptions is it's an RSPB kind of owned brand, and we at the Yorkshire Dales have worked in partnership with the North Yorkshire Moors and healthcare professionals to create a nature prescription for North Yorkshire. So we have two slightly different versions of our calendars, which we'll look at in a little bit more detail further in the presentation. But basically what they are is a calendar of monthly activities that people could do within our national parks, but also within their local green spaces as well. And our real kind of driving force between working with the Moors and the RSPB on this is really about that cyclical relationship that we have with nature. And when people are feeling more connected, they're much more likely to kind of want to protect these places as well. And then of course all of those wonderful wellbeing benefits that can come from doing some of the activities within these calendars. So yeah, today we're going to learn a little bit more about the nature prescriptions. I will do an overview of our work in both national parks, and then Olivia will finish off with chatting in a little bit more detail about the research that she has started with York St John. Next slide, please, Anthony. Yes, so really nature prescription, it's lots of you may have heard of this before. There are different versions of this all over the country. So the bread and butter of what a nature prescription is that it's a guided conversation between a healthcare professional and their client or patient or person that they're working with. And it's all about encouraging them to connect with the natural world to benefit their mental and physical well-being. And I'm sure lots of you on this call know exactly how important that is. So these conversations between the healthcare professionals and the people I'm working with are supported by this booklet, which includes monthly ideas and suggestions to enable people to explore different ways of connecting to nature that are really personal and meaningful to them. So there's about 7 or 8 different nature connection activities in each month that people can either choose to work through one by one, or they can choose to just do one of them. And yeah, really kind of connect in their own way. So it's free to the recipient. The way we've worked with this one is it's been joint funded by us at the Dales and the Moors. So it's very much free to the recipient. It's free to the healthcare professionals or community groups that we're working with. It's a non-medical approach based on really accessible and self-led activities that people can do from anywhere. So although it's us as national parks working together on this with a view to people potentially growing in confidence and wanting to visit national parks to connect with the landscape there at some point, most of the activities can actually be done from one of them every month can be done from inside the home, and all of the rest can be done with no need to travel in local green spaces, so people can connect in places nearby their own homes. The good thing about the nature prescription is it's quite different to other nature-based offers, so it's not necessarily reliant on referral into activities, although we are seeing that some kind of primary care networks are starting to form groups around these nature prescriptions. To begin with, it's very much about the healthcare professional providing this to the person, and it's something that they can go and do independently. And nature is very much at the forefront of this calendar, so it's all about that connection and that quality of time spent outdoors, and not seeing nature as a backdrop, but very much about how enabling people to have those quality moments outdoors that really matter. And like Olivia alluded to around health inequalities, this is really encouraging people to connect with nature wherever they are. So it's hopefully addressing some of those barriers and inequalities to access in nature and green spaces, which we know there are huge barriers in terms of accessing national parks. So hopefully this can kind of go a little way to addressing some of those. Next slide, please, Anthony. And I think if you just click again. Yeah, so I'm not going to go too far into detail on this because I think we're at a point now where the evidence is there. It's really well respected. There's a lot of it. People really know, and actually it would be hard to disprove now that nature isn't good for us. So but a little bit of a thought process around why we've chosen this. So some of the evidence suggesting that nature really benefits our health and well-being through improving our mood, reducing feelings of stress, helping people to feel more relaxed, improving our physical health, our sleep quality, reducing loneliness, improving confidence and self-esteem. There's all sorts of different kind of benefits to this, and increasingly there's more evidence as well, which Olivia will talk about in much more detail, around the benefits of connecting to nature. So the actual quality connection, which could include enabling personal growth, increasing vitality, improving happiness and life satisfaction as well. If you could move on to the next slide. And if you just click again, there should be a nice quote at the bottom of this one. Yes, a really nice quote, a bit of patient feedback, which you can all be reading. But all of the activities that you'd find in these nature prescriptions are all very much evidence-based, all linked to the University of Derby's 5 Pathways to Nature connection. Not sure kind of what involvement everyone on this call will have had, so just a quick run through what those pathways are. But the first one is very much around senses, so really inviting people to explore and experience nature through all of the different senses. It's around beauty, so seeking and appreciating the beauty of the natural world. Emotion, noticing and welcoming the feelings that nature inspires within each of us. Meaning, so celebrating and sharing nature's events and stories. And compassion as well, so helping and caring for nature. And the way we've really tried to address that 5th one is by putting in a way that people could help nature or care for nature in that month. So yeah, very much all the activities are focused on these pathways, and very much around the kind of quality of time that people would be spending outdoors. So not necessarily the minutes or the length. If people can just get out for a couple of minutes each day, there's so much benefit to that. And we hope that by having these calendars as a little prompt, maybe hung on the wall or somewhere in the home, with some really nice pictures, imagery, colour, that hopefully that will kind of encourage people to get out, even if it's just one day a week, compared to nothing is a benefit hopefully to that person. And Anthony will probably be able to share these slides after, and there's a nice little video in there which you can watch in your own time. So yeah, if you could just skip on. Where are we at? February. Yeah, so this is just an example of one of the pages that you'd find in the Dales calendar. So you can see the activities there. They've got little boxes next to them. People can use this calendar however they want. They can tick off those activities as they move through them if they want to. But we're really clear, although it's called a prescription, it's not meant to be prescriptive. It's not a challenge in any way. It's very much an invitation for people to work through these activities how they want to. Like I said before, they could do as many or as little as they like, and they could even kind of experiment with doing some of these activities in April or May if they wanted. These calendars are designed so that what we're saying you can see in this month, you actually should hopefully be able to see where you are, and individuals can kind of personalize it however they want. They are laid out in a monthly way, but there's not necessarily dates on any of these pages, so people could actually come back and use these year on year, however they want. If you just go on to the next slide, Anthony. Oh, in fact, it's the one after that. Don't worry. Yeah, this one. So you can see here the how people might be able to personalize it, create their own nature diary. They might want to write down what birds they'd seen that month and then kind of refer back to it the year after and compare and make their own little nature notes. And there's a little bit of blank space as well down the bottom there where people can draw or sketch or whatever it is they want to do. So if you just go back a slide, sorry Anthony, I'm jumping around now. Yeah, so this is just a look at one of the pages from summer. So as you can see, like really nice pictures and colours for people to look at. And yes, so when we've been saying things around kind of common foxglove or dandelion clock, we've actually got a little image there that people can refer to if they don't necessarily know what that is. And yeah, if you skip on, once every 3 months, there's a QR code as well and a little evaluation, self-evaluation that they can do. So you may have seen this before, but just down in the bottom left-hand corner there, people can actually sort of evaluate how connected they feel to nature. And again, might want to compare that in the following year. This is July's page. So in the Dales, we've said that people might want to visit the Ingleton waterfalls in July. So we've tried to link this to a bit of a description about activities they might be able to do there, how they could get there, or the fact that they need a ticket. I know Heather's done quite a lot of work as well in the moors to sort of link to public transport, which is really important. And then the top section there around helping nature this month is something that they might be able to do to support nature. So yeah, I think if you can skip on.
Right.
Is this my last slide, Heather, or are you doing this?
This is me.
I was ready. Yeah, okay, fine, perfect. Yeah.
I'm taking over. Brilliant. So just to take a step back, just to think about where this has all come from, I just thought we'd give you a little bit of background. So as Kiri mentioned, it is an RSPB initiative, and it really started in Shetland way back in 2018. And it came from a local GP who had people presenting in surgery with low-level mental health difficulties, and thought, gosh, we live in a beautiful place. How can we use this beautiful place to improve people's well-being? So the GP got in touch with the RSPB to see, can we collaborate in some way? And so this is where the nature prescription really came to be. And they started doing some of the little suggestions for connecting with nature, and they got some really good anecdotal feedback from the patients. So the RSPB recognised there was something in this, and actually they needed to evaluate it and to really do a pilot study and get some proper meaty evaluation from it. So that led to a collaboration with RSPB Scotland and Edinburgh and Lothian's Health Foundation, and they launched their nature prescriptions in 2020, right when COVID happened. So it was quite a difficult time, but actually it was a really good time because this pilot was in Edinburgh in an urban setting, worked with 5 GP practices, and did manage to get some really good feedback from there. And I'll go on to some of that feedback in a little while. But following that, our colleague in the Peak District National Park heard about this, and they brought it to England with the RSPB back in 2023. And that's when we heard about it and thought, yeah, we need to bring this to North Yorkshire. It sounds brilliant and the evaluation is there. So if you go on to the next slide, please. I think if you click again there, brilliant, thank you. So one of the key things from the evaluation was that patients were saying it was having the permission from a trusted healthcare professional to spend time out in nature that made the difference. So yes, they identified it was a powerful and deep emotional boost or tonic that does help, even as simple and as basic as it may seem. So some of the suggestions, I know Kiri has said activities, they're not, you don't have to be really active, they're suggestions. So a suggestion could be just open up your window and listen to the bird song. It could be plant some seeds on your windowsill and observe what happens over the next days and weeks. So they are suggestions. They can seem really simple, but they are really effective. But like I said, it was having that permission from a trusted healthcare professional that really was a really key driver for the success of this. And you can see there 87% of patients considered it very likely that they would continue with the nature prescription after the initial activities that they'd done. 87% of patients felt that GP should be able to prescribe nature for health. So really great feedback being received there. So we'll go on to the next slide, Anthony. So also they got some feedback from the people that were prescribing. So in the pilot, it was GPs. And the fact that it was low cost and it was safe and sustainable, it's got no side effects. And they're really easy and accessible. Like Kiri said before, many of them can be done in the home. And they're very much how we've designed the calendars, that yes, people can start in the home. And if they do then have a garden, then they can progress to the local green spaces. And then our aspiration is that they then come and connect with the national parks. But yeah, and as Kiri mentioned before, this is free. We have got the funding for this, so this is free. One GP said how amazing they found that people were really positive about it and how it can be used alongside other techniques that they use. And again, it was just a really delightful and inspiring resource. So we have gone through a co-design phase with the calendars that we have. We worked with social prescribers, and they really brought their understanding of their clients, their patients, their service users. And so when Kiri and I were making suggestions for the activities, they could come back to us and say, oh, your language is a bit complicated there, we maybe need to simplify it a little bit. The suggestions you make in my patients or clients would never engage with that. So we went through a really great co-design element of this with the social prescribers. So next slide, Anthony, please. Yeah, so it's all about improving the well-being and strengthening that personal connection to nature. I've mentioned about maybe not using the activities word, but it's the suggestions for people. But it's a real springboard for people to go further afield. And our colleague Sarah at the RSPB has a very powerful bit of feedback from a patient who used these calendars. As somebody who was quite homebound and just started off by opening that window and listening to the bird song, they remembered that they used to like watching birds. They remembered they had a pair of binoculars hidden away in a cupboard and got them back out and started bird watching from home again. And then that led them to go out into the local green space and into the local park. And then a year down the line, they're now volunteering at an RSPB reserve. So very small steps have led down through the year to a really big step. So that's what I particularly find really inspiring about this. If you click again, I think there might be another lovely quote there, Anthony. Yeah. So patient feedback, it's been a saviour. It's allowed me to listen to my feelings. It's all about slowing down. And I can say from my involvement in developing this with Kiri and the RSPB, it made me slow down. I've worked in nature for nearly 30 years, but it really made me slow down and appreciate nature better. So it was really good for my well-being being part of this project. And it's just looking at the beauty around us and just feeling so much calmer. Okay, next slide, please. Where are we? Yeah, so it's a prescription. We've worked with GPs, we've worked with social prescribers, we've worked with wellbeing, people working in wellbeing. Don't be put off by the fact that it is we say it's a prescription. There's no prescription that needs to be written out. It just gives that weight from a trusted sort of professional working in this field that yeah, people really identify with that. It's that permission that people have needed to really sort of support them into doing this intervention, and it really helps people have a focus and gives a clear direction of how ideas of how they can connect with nature. Some people have maybe just used one of the suggestions in a month and just used that every day or every couple of days, or they may have used a suggestion from July and actually it suits being used each month. So people can really tailor make these calendars and these suggestions how they would like to. So when we work with people for them to prescribe these calendars, we do some training with those professionals. So we go through all the background of the calendars and why the evaluation of them and why they're important. And the fact that it's the conversation that they have with their patients or clients or service users, just explaining the background to it and explaining the content and how they can really tailor make it for their own needs, to meet their own needs. So I think the last slide that I'm just commenting on, if you wouldn't mind, Anthony, please. Brilliant. It's just to show we've been doing this for a while now. And we have connected with lots of primary care networks and people that work in the NHS across North Yorkshire. And we've been working with local charities as well. living well teams across North Yorkshire. We've been working with Catterick Garrison. We've been working with early intervention in psychosis teams. So yes, we're really, really happy to work with lots and lots of different people. So we have reached a huge number of people, but we want to reach more. So I think the next slide is over to you, Anthony.
Excellent, brilliant. That's great, Kiri. Thanks, and cheers, Heather. Yeah, so what's kind of exciting is that I had this chat with Kiri and Heather quite a long time ago to kind of say, oh, can you come and do one of our webinars and talk about the nature prescriptions and the amazing work that you're doing? But since then, a collaboration of the Yorkshire Dales National Park, North York Moors National Park, Howardian Hills National Landscape, Nidderdale National Landscape, and the North York Moors Trust has secured funding through the York and North Yorkshire Combined Authority to extend the work that has been set in motion through the nature prescriptions and look to deliver a national health service for North Yorkshire. So it is a pilot programme with funding running through to the end of March. As I said, it does cover all of North Yorkshire's protected landscapes, so is bringing them all together and has the aim to increase health and well-being in the county and promote these amazing protected landscapes as a vital health resource. So within the programme, there is extending the nature prescriptions training. So we've kind of reached out to more local authority groups. So I did some training for the Healthy Lives team in North Yorkshire Council. We've been doing training with the First Contact mental health practitioners and other mental health professionals. But we've also got a chat with the Department of Work and Pensions early next week to kind of look at how they could use the nature prescriptions to support the individuals they work with who are impacted by mental ill health. So really exciting to do that. But through the programme, we're also going to be delivering some taster sessions. So referral staff and those staff and organisations that support people on a one-to-one basis can get out themselves and try some of these activities or experiences that are in the nature prescription calendar. And then we're also going to be running 10-week nature and wellbeing courses. So there's going to be 2 in the Yorkshire Dales, 2 in the North York Moors National Park, and 2 in the Howardian Hills National Landscape. So yeah, I am lucky enough, and that's why I've jumped in on this for this slide, to be supporting the programme and to be supporting Kiri up in the Yorkshire Dales through this piece of work. So yeah, I know we do want to work with established groups for these 10-week nature and wellbeing courses. They will be running from mid-January through to late March. So yeah, we've got our cohorts up in the Yorkshire Dales, and I know they're well on the way in the other areas as well. But a part of this National Health Service for North Yorkshire project is to just raise more awareness of these nature prescriptions, of using the national parks and the protected landscapes, but also kind of look at demand. Is there demand out there? So, you know, if something like a 10-week nature and wellbeing programme is of interest to your organisation, your service, do get in touch so we can sort of capture that. As I say, the funding runs through to the end of March, but it's very much a pilot, and it's very much, we want to go back to the York and North Yorkshire Combined Authority to show the progress we've made with nature prescriptions and the impact of the 10-week nature and wellbeing course, which is being evaluated by York St John, but also that there is demand to do more. So yeah, you can get in contact with myself or anyone else on the call, Kiri and Heather, and we can connect you with the right people for that. So yeah, that was just a little plug for the new programme, and I'll pass over to Olivia.
Great, thanks, Anthony. Hopefully I'm coming through all right, because my microphone has a history of being a little bit dodgy. Thanks for that. So as you've all heard, there is a lot to this project. It's not just in the Yorkshire Dales, but also spread potentially all over North Yorkshire. The specific aim of my research project is to look at the impact of the nature prescriptions on both the people who are prescribing the nature prescriptions, and that could be anybody from a GP or a link worker within the NHS to people working with kind of community social prescribing groups or mental health charities. So it's really quite a wide range of people, but also the people who have been receiving the calendars as well, and just assessing the impact of their well-being and finding out whether it has broken down any barriers of accessing nature for them, whether that's just because it hadn't particularly occurred to them, or whether there's something a little bit deeper at play. And that links into the health inequalities aspect of it as well, because as we've already discussed, not everybody has an equal amount of access to national parks or nature in general. So this research project will hope to interrogate how or whether the nature prescriptions calendar in and around the Yorkshire Dales National Park has had an impact in addressing that, and in reaching out to the national park's underserved groups, as they're called. And it will also hopefully add to existing research that's been done in the Edinburgh pilot, and add on to information that has come through from the evaluation that the Peak District have done in theirs. The Yorkshire Dales National Park and the North York Moors National Park are essentially a year behind the Peak District, so it'll be really interesting to see what comes out of this project and compare it a year later to the data that the Peaks got. There's also another aspect to it, which is looking into how protected landscapes, including national parks, can be used, and I hesitate to say the word used because it positions these landscapes as a finite resource, which they're not, and I'll touch on that more a little bit later. But it's kind of potentially looking how those landscapes and the authorities that look after them could contribute to public health. Can we have the next slide, please, Anthony? Thank you very much. So I'm really quickly going to kind of skim over what the found out. So their evaluation consisted of conversations, a focus group and a workshop with the people who had been prescribing the calendar. So this is people who were leading groups in green social prescribing and using the calendar as a base for their activities, or it was people who had been giving them out to patients or recipients one-on-one for their health and having those conversations that Kiri mentioned earlier with them. And the standout successes that came out of that were that it highlighted really effective partnership working in between the Peak District National Park Authority and other organisations who had become involved. The focus on the rural area was really positive, the materials were accessible, and there were lots of benefits for individuals, most notably lonely or housebound clients, and generally people who were older. It seems to be the cohort that the Peaks were working with. A couple of barriers were highlighted, including format issues, recipient motivation, and potential difference in approach, whether it was being used with individuals or with groups, and that'll definitely be something that will be interesting to compare with the data that we get from the Yorkshire Dales National Park as well. Significantly, something that came out was that the prescribers were often busy and overworked, and I just wanted to highlight that because there is not a lot of data about green social prescribing in general, and I think that this is one of the reasons is that healthcare professionals in general are so busy that they don't always have time to either record information, and that was highlighted in the Edinburgh pilot, is that a lot of the GPs who were involved in the pilot didn't have time or were too busy to record on the system that they'd given us out, or they couldn't give a survey to the recipient, so hopefully this will go a little way to filling in that gap as well. Next slide, please, Anthony. And I'd also like to mention now, just off the back of the Peak District, that thus far there's been very little research done into the attitudes of recipients of the calendar. We've got some really, really nice quotations that were in the PowerPoint earlier that Kiri and Heather highlighted, but those have all been either gathered secondhand from healthcare workers who have recorded and then passed them on to people doing the evaluation, or they've been written down online or on a piece of paper in a survey and handed in. There hasn't been very much kind of in-depth qualitative face-to-face research with the participants, which again I think is really important and is where this project comes in. But what we do already know is that having contact with nature or being close to nature is good for you. And on top of that, having a relationship with nature is good for you. And one of the main things that the literature review that I've been undertaking has shown is that nature connection is far more important for well-being, for mental health, than nature contact or just being close to nature. And I think that Heather gave a really great example of this when she introduced the history of the Nature Prescriptions Project with the Shetlands, which is probably one of the most beautiful places in the British Isles, yet people there were still feeling down and didn't necessarily have the mechanisms for connecting with nature. So I think that was a really nice point that Heather made. We also know that there is a greater proportional positive impact on people who come from socially and economically deprived backgrounds when they have nature contact or nature connection compared with people who don't. And if I'm sure that quite a few of you are within the healthcare sphere, and you'll probably be aware already that those who have the greatest need generally tend to have the least access, and it's absolutely the case when it comes to nature as well, and that's been shown through various studies. And there's also been a lot of research done into the positive effects of urban green space and parks on health, which I think again is really significant because the people from socially and economically deprived backgrounds generally tend to be from urban areas. However, looking at these two together has highlighted a real gap in the research, and that is rural green spaces and how people access them, because in the past 2 or 3 years there's been a little bit of research done into the actual quality and ability to access rural green spaces as well as urban green spaces, because just because they're there next to you, it doesn't necessarily mean that you either have the permission to go into the field that is next to your house or the ability to navigate your way through this landscape. So that's another consideration and another, I realise I'm saying we're trying to fill a lot of gaps, and there is only so much that we can do within this, and I am going to get more into the specifics of exactly what we're doing to evaluate it later. And as I've already described, some populations do have difficulty accessing green space in national parks, and that may be purely accessible reasons. There's no transport, it's too far away, it's too expensive to get there, but there's also the fact that various groups of people often don't feel like the countryside is for them, they don't feel welcome, they feel that there are various risks associated with visiting it as well. And finally, we know that loads of people are interested in it. It's why there's a webinar series like this run by Anthony. The public are interested in nature and health. The government are interested in it. Everybody's here. Everybody who's here is interested in it. However, that interest hasn't quite been reflected in academic research yet, especially when it comes to national parks. And could you pop it onto the next slide for me, please, Anthony? And that's really where the gaps are. So there has in the past 10-15 years been a lot of research done into nature in general and its benefit for health, but specifically in the UK, there is a massive lack of research into what impact national parks and protected landscapes could have. And just to give you an example, when I search on Web of Science for published papers into nature and health, green space and health, I get 1,500 results for the past 10 years. When I search UK national parks and health, I got 3 relevant results out of everything, and that's just kind of to demonstrate the gulf of understanding that there is between what nature can do and what natural protected landscapes could do, because essentially they should be the same thing, but it hasn't really been linked up yet. There is also, compared to other national parks in the world, a special dimension to the UK's national parks because they are working landscapes and they have people and communities living within them. So asking how these landscapes can benefit the well-being of the people within them becomes, I think, much more significant for the UK because these communities exist in them rather than coming from elsewhere to visit. Although, of course, we want to encourage visitation for well-being as well. Could I have the next slide, please, Anthony? So there have been some challenges to the research so far. Before I dive into those, I will really quickly outline what I am planning on doing. I am 6 months into a 12-month project, so I can't dive into as much as I would necessarily like to and answer all of the questions that are brought up by the literature review. But what we are planning on doing is releasing a survey as a service evaluation to all of the healthcare professionals who have been involved in giving out the calendars, and that will be to both gauge their attitudes towards it and also to identify any barriers that they might have to prescription, but also any perceived that the recipients might have once they have received it. And the goal of that is to talk to both NHS staff and people who are working within the community as social prescribers or as mental health charity workers. We will also be holding focus groups with the recipients of the calendar, and this is where some challenges came up because due to the time constraints of my research and just general data protection and NHS research ethics, which a few of you may have come across, it wasn't possible to talk to anybody who had been given the calendars via the NHS. However, because the Yorkshire Dales National Park has such strong connections with these community organisations that they have worked with to both develop and then prescribe the calendar, we will be recruiting people via these groups to speak to them, which is something that hasn't been done before in terms of research into specific nature prescription projects. So as you can see on the screen, I've listed the challenges that I've kind of outlined there alongside the methodology that we'll be pursuing. The survey will be both quantitative and qualitative, so we should have a really good spread of results to be able to compare, in some cases directly to the results from the Edinburgh pilot prescription and also to the feedback from the Peaks District, which was much more qualitative. And of course, there are also ethical considerations within it as well, because we're talking about people who may be suffering from mental ill health. And in all research, we obviously want to limit any possible harm to the participants as well. But like it says at the bottom of the slide, all of these challenges are really, really relevant to the research project itself and will inform the conclusions that come from it too. And it will also be data-led as well. So currently, I've mentioned many times that I plan to look at increasing well-being and decreasing health inequalities via the Nature Prescriptions calendar. But once I start speaking to people, receiving surveys back as well, it may be that something comes out that surprises us as well. So that's the plan, but also I'm very excited to start the actual data collection as well. Could I have the next slide, please? Could I have the next slide, please? Sorry.
It's moved on for me. I can see the different coloured boxes.
Yes, yeah, I've got that now. Thank you.
Yeah.
So this is a logic model that I put together to kind of demonstrate the process of the research project. I won't go too deep into this, and if you want to have a better look at it, hopefully you'll be able to see it in the presentation at the end. So if we could move on to the next one, that would be great. So this really is the big question, and it's what I alluded to at the start, is why does this project matter? Because it is a relatively small case study, and in the context of UK national parks and protected landscapes, but it could highlight the possibility for national parks to and well-being. It could be considered a kind of feasibility study, which is what the Edinburgh pilot did. However, it was focused on urban and peri-urban communities, and rather than a specific landscape. And having this protected landscape national park lens could show how protected landscapes in the UK, which it said on one of my earlier slides, make up 10% of all land cover in England, could be leveraged for better health and well-being in this country, especially in a time when mental health is at an all-time low. It also demonstrates a bit of a wider model of thinking, a systems thinking perspective, which is the idea that things don't operate separately. And Kiri and Heather have both mentioned earlier that the RSPB are very keen for this calendar to not only benefit well-being, but also to have a positive impact on pro-environmental behaviours. And that is something that Nature Connection has been shown to influence in the preliminary studies that have been done. The University of Derby, for example, have done a lot of work looking into that. And that's that people who connect with nature in the way that is demonstrated in the Nature Prescriptions calendar are more likely to then exhibit pro-environmental behaviours. And again, the example of the person who started volunteering with their local RSPB organisation is such a great example of that. And it's the idea that these two crises, which some academics have called the eco-social crisis, can be looked at together rather than separately. You know, we don't need to solve mental health over here and solve the ecological crisis over here. They can be brought together and considered in a way that is positive for both of them. So although this project is relatively very small, it will hopefully demonstrate the big impact that this kind of thinking and this approach to health could have. And I think that's everything from me.
Excellent, brilliant. Thanks, Kiri. Thanks, Heather. Thanks, Olivia.